the technical side, there's essentially a parallel set of services and specifications to the ones I just listed under policy with regard to addressing authentication, information sharing, routing. And here we add directory services, which I'll come back to in a minute. And these two should be coordinated with the state-level efforts. And here the additional thought is that the ONC might support, we would recommend that they do support some pilot projects with the recognition that all of us wizards sitting around a conference room table probably can't identify all the technical requirements and obstacles and fixes needed to create a robust information sharing environment. So we'd like to see some of the key ideas that Mariann and Doug described put to the test in some implementation very rapidly so that we can see what really works and what doesn't, and then make refinements as indicated. Next slide. I've pretty much summarized this. The key here is that we don't imagine that enabling organizations are of one particular type. They could be a variety of enterprises, vendors, other networks that could qualify to provide the key services that users need in order to share information. And frankly, as the second bullet says, they may not be organizations at all. There may be some software services that accomplish some of the same functionality. We're not going to prescribe the nature of the service offering. We're going to prescribe the criteria that they have to meet. And as I said earlier, we may explore whether these need to be certified by some external party. Next slide. And as far as the government role goes, the trust framework is something we think the government needs to speak to because of the high public sensitivity of these exchanges. The government has already created some incentives to support information exchange, and it will continue to need to do so. We would like the intervention by the government to be minimal and not to interfere with existing successes in information sharing. The incentive programs such as ARA should exist to improve interoperability, privacy, and security. And as I mentioned, we think the government can support testing and validation of the approaches that emerge. Next. So where we are in our process, we've made some recommendations of the kind I just summarized, and we will now move on to a little deeper dive into the issues around identity proofing in terms of assurance levels and the technologies to provide those assurances, and in what manner the enabling organizations need to be certified if they are meeting the tests of those assurance levels. And then we'll talk about directories in the next month, trust fabric in June, and governance over the summer, although I think the governance issue, we heard from the policy committee last week, they would like us to speak to that very rapidly if we can, so we may need to accelerate our work in that area. Let me see if there's any more here. Is there another slide, or are we at the end? We're at the end. So that's our summary. Thanks very much for taking the time to hear our updates, and I'm sure now we can have some broad discussion. I don't know who will facilitate that, but I'll turn it back over to you.
I'd very much like to thank Dr. Fridsma, Ms. Yeager, and Dr. Lansky for the very informative presentation. What I'd like to do now is open it up for questions from the board first for the panelists. And the panelists, if you could please identify yourselves prior to answering questions for those on the phone.
This is Seth Foldy. I was wondering about the term enabling organization. I understand there may be many different types of enabling organizations, but is it quite clear that state-level health information exchanges or state-level health information exchange planning processes will be considered an enabling organization for the purposes of this planning?
Well, this is David Lansky. My take on that is we don't know yet. My guess is, based on the variety of state plans that will emerge, that it may be that in some cases the state-level entity is an appropriate vehicle for asserting the identities of users within their domain, and in some models it won't be. Maybe Doug or Mariann has a better understanding of that than I do.
Yeah, thank you, David. I think you're right. When we initially conceived of these enabling organizations, we were thinking very much on a policy and a technical aspect, things like routing, identity proofing, authentication. I think the states will, in some models, will provide some of those functions, and in other models, they may just assure that they exist in some fashion. In the broader sense, an enabling organization, states are going to be a critical partner in this, because clearly there are issues that are within the purview of the state with regard to policy, legislation, and other things in which states can be very much an enabling organization to help with information exchange. And so I think in the broad sense, beyond just what we've talked about here, states clearly are an important enabling organization in that sense.
Yeah, hi, Mike Lardy from the board. Question regarding the Connect Gateway and its appropriate use in the NHIN Direct and for federally qualified health center world and the safety net clinics. Would you see that as being appropriate for them to use that as a vehicle to then share on the more direct level, and also giving them the opportunity to then connect with the NHIN if they have that facility?
Yeah, I think, this is Doug Fridsma, I think both NHIN Connect as the gateway and the NHIN Exchange with the participants who have signed the DIRSA and are exchanging information are going to be important partners in this simpler exchange that is described as NHIN Direct. For some organizations, they may find the simplest and easiest way to exchange information is to sign the data use agreement, to install the NHIN gateway, and join a community of participants who are exchanging information. I think there is work underway to make sure that regardless of the path, whether someone chooses to take an NHIN Direct or an NHIN Exchange approach, that there will be interoperability supported and that people will be able to achieve the meaningful use objectives with those technologies.
This is probably a question. This is Kevin Hutchinson. Probably a question to the ONC folks on certification, because there appears to be two aspects to this. You've got a need for a certification body, and you've got a need for enforcement around technical specs, policy, and process are probably the three categories in my mind that fall into the NHIN, the NHIN, the National Health Information Network, whichever the phrases we're using today. But there hasn't been, and I'm looking for some direction on timing of when you think we'll have a certification body. I know we're working through on the standards committee level and the policy committee level, even a certification body for EHRs or electronic health record, not necessarily the software, but the functionality. And one point I wanted to make during the presentation, we keep talking about the EHR, when in fact what we mean at both the policy committee level and the standards committee level is the functionality of an EHR, whether that's a piece of software or a collection of pieces of software that make up the capability to enable a provider of care to have the capability to form an electronic health record as defined by the meaningful use, functionality, and criteria. So you can have a modular EHR approach, or you can have a single piece of software that goes in these practices. But there has to be a certification body that enables that, and there probably has to be a certification body that enables compliance, both technical policy and process, with the connection to the National Health Information Network. Is that in the works? Are we going to see some interim final rules or some proposed regulation that might go down that path?
So with regard to certification, the criteria for certification have been released in the IFR, and so we're under a comment period for that. There is ongoing work on an NPRM that will address exactly those issues with regard to certification. We're working diligently on that, and we hope to have something out very soon. We recognize the importance of having that process out there so that people know what are the steps they need to follow to get certified, and there will be a certain amount of time to be able to stand up those organizations and things like that. And so you're absolutely right. It's a critical piece of the puzzle, and we are working on it. If we had more hours in the day, we would work more than that.
If I could just add that, with that said, there will be a rulemaking process around governance mechanisms for the NHIN, which I think will sort of sift through that, correct?
Yeah.
With just about 4 minutes remaining, if Art, you'd like to ask, we have a few online questions, but we'll continue.
Yes, this is a question probably for Mariann. This is Art Davidson. In the slides, you point to some successes to date in 2008 of having the CDC and the NCI being part of Connect, and then in a subsequent slide, you talk about CDC and states engaging in future technology. So, what exactly did those two and NDMS as well? What exactly did they do with the NHIN Connect 1? And 2, how does this line up with their strategies, NCI using the CA grid and the public health grid from the CDC? How do those, the NHIN Connect and these other technologies to achieve the same 6 basic fundamental thing, or I think it was 6, whatever number you had at the bottom there, those foundational pieces, how do they mesh, and where do you see them going in the future?
Well, this is Mariann Yeager from ONC. I don't know that I can speak to their particular plans because each agency has their own strategies, but I can speak to what was accomplished in 2008 and my knowledge of kind of how it fits and connects with this. But CDC, NDMS, and NCI were part of the NHIN cooperative that was the group of 20-some entities that worked from 2006 to 2008 to develop an initial set of core capabilities for nationwide exchange. And there were a set of demonstrations in 2008 where they actually demonstrated the use of their implementation of those specifications and trust, and demonstrated their particular use case to the AHIC, and then again at a public forum in December. They are in the planning stages of where they go from there and understanding how and where they would use Connect with respect to their overall strategy. Our understanding is that CDC is in fact implementing Connect to exchange data with 3 states for public health reporting purposes, and beyond that I think they could probably speak best to their plans. But it's going to be an evolutionary path, and each agency has their own specific plans. So.
Thank you.
We have just 1 minute remaining, so what I'll do is I'll take a question or two from the online questions. There were many, but these may summarize or address multiple questions from the online audience. This question comes from Rob Levy. I assume that the NHIN Direct is meant to be an iterative and incremental development process, increasing capabilities and functionalities over time. Is there a broader, overarching strategic plan and document?
So I can sort of address this. Indeed, we want this to be iterative. We want this to be incremental, and we want it to be driven by the real needs out there in the community. We don't want to do this in the abstract. We want to ground it in actual real-world experiments. And so in that sense, we do have that. We are also creating an architecture or sort of an overarching framework in which these components can fit. And so I think at the end of the day, we hope that iteratively we can build these foundations and make sure that we have all of the pieces fit together at the end. As far as a document, we don't have we have an architecture document that we're working on and a couple of other things that will probably be out within a very short period of time.
Thank you. I think we have time for one more. This one comes from Greg Smith. Can you clarify 2 issues? Can an eligible professional and hospital meet meaningful use criteria just connecting to the NHIN? And 2, how does the NHIN relate to state HIEs and or regional HIEs?